a lot about our culture at Sentara. Now, again, we usually limit things to 3. Okay, we have 3 strategic imperatives. Okay, as you'll see them up here. The first one being, see if I can get this right here, Bernie. Really around, first of all, is always improving. Okay, really focus on everything from patient satisfaction to our quality and safety initiatives to our work environment index and whatnot. We strive the top 10% performance in all of those particular areas. And anywhere you see the blue square here, I've aligned of how we're engaged around the learning program, and we get the support from both Dave Berner, CEO, and Howard Kern, our president, and how engaged we are with that process and making these top 10% performers really engage with our learning program also. So again, very simple, always improving. And really the next initiative here, I don't know if you can see that, is caring for defined populations. So you can see the continuum here, if you can follow this yellow, really all the way around from our long-term care facility all the way through our continuum of care, through long-term care and through our hospice care. So really engaging around the clinical integration with physicians, our current staff, and really focusing around, we heard a lot earlier today around population health, really around our transformation of care. So that's basically our second initiative there, caring for defined populations. I think most of us as health systems are looking in that direction. And then lastly, and the third imperative here is creating growth. Okay, that's organic growth in the markets that we're in, product redesign, using our technology to expand and integrate with other systems. Really our new care models, all those are part of our strategic plan. So, and then towards the bottom here, you can see our strategic enablers here. And again, ongoing development of our members of the team as a major enabler of the strategic plan, just like our financial support or our information technology. So a big part of that is our learning agenda. And I think we really started our being a learning organization probably around 2005, wouldn't you say, Dave? And we really started building that at the very senior level, okay? Dave Berner, CEO, and Howard are the first people through that program. And that's everything from 360 assessments around talent management and how we set those goals around leadership development, our talent charts, how we design our executive programs and whatnot. Both of our leaders, Dave and Howard, are very supportive of those initiatives. Not only supportive, but they teach. And a lot of our healthcare executives in our organization teach in our healthcare academy. So they've been very engaged with that. And as I say, part of my role in HR is first of all, is to wear the Sentara hat, is that I have to know operations as well as Dave and Howard, our CEO and COO, and they have to know, and what makes me feel good, is that they have to know as much about the learning agenda and the HR agenda. And when they can speak to that, I think I've done my job. So that's really how a lot of this is engaged. It starts, from the top down, and I think, both Dave and Bernie have been instrumental in putting all this together. What we're going to talk a little bit about today is more around the front line and what we've done around the frontline manager. And I'm going to introduce Dave Woolwine here as our Chief Learning Officer, and Bernie Varnes. I don't want to take any more of their time because that's what you want to hear about the program. So, Dave? Is that where you want to be?
Yep, that's good.
Good.
Thanks, Mike.
Uh-huh.
All right, so I've got five minutes, and I'm going to take about 60 seconds and give a shout out to NCHL. So What I wanted to be able to do is, first of all, I've heard lots of good feedback, Kathy, about the speed dating, okay, and that you can go from one cycle or one session to another. And I actually heard some comments going on, said, even if it's a great session and the next one really sucks, I can just rely that I'll be able to move to another great session after that. So Mike has got us off to a good start. This is where it starts to suck. So I'm going to try to go through this from a very high level. But the other thing that I wanted to share with you is a lot of what you're going to see here had to do with guys like Joe in the back from North Shore, from the folks at Henry Ford, and other folks that we have learned from. And so that's the beauty of NCHL, is that you can be able to have some of this, because it's really an opportunity to be able to learn from each other and to be able to explore. So I'm going to show really quickly a couple of slides here, and then I'm going to turn it over to Bernie. This is basically our talent development cycle, and it started, as Mike said, back in 2005. And what we did, and Mike mentioned it earlier, but Dave Byrne, the CEO group, work group, were the first groups that went through a 360 assessment. And for the first time, the CEO and other folks were talking about their strengths, their weaknesses, what is it they could do better, what is it that they really, the group really relied on them for. And then we looked at that 360 assessment as really the start point. We came up with our own leadership competencies. You see all the things that are in here. But after that 360, we provided every executive, every leader that went through that process with one-on-one coaching from the folks on my team, using the Hay Group. The Hay Group partnered with some of that, and we're now working with Center for Creative Leadership to do the same. But what really started taking traction is that you can give leaders information, and when they see how they do as in terms of a leader, what they're really good at, what they're not good at, and they see it in print, and they have an opportunity to work in an impartial coaching situation and help develop that. What it really started to take traction is when we went to the talent reviews. Now, this is a system that we did where we looked at the top 100 leaders and eventually top 400 leaders, and they would get assessments, and then they would also get an opportunity to be reviewed in terms of their strengths, their weaknesses, their career aspirations. What's their development plan in order to be able to move them forward on the particular tracks that they're looking for? What positions are they looking for 5 years from now, 2 years from now, et cetera, et cetera. And so every leader was discussed as far as those abilities with Dave Byrne and Howard and Mike and myself and others that were in the room to be able to give that feedback. Usually it was a senior leader that would present that. And so it was as much about the leader's development in terms of growing them as a leader as it was about the executive presenting it. Did they know their people? Did they know their strengths? Could they talk candidly about things that were not good about those folks and what they were doing? So the talent reviews took on a whole nother level of clarity and really helped with that. And then we also offered, where you had skill gaps, where you had issues that you really wanted to be able to develop, then obviously we had the leadership development pieces, and we tiered that by level. So you have the first line level, then we had manager director, then we had the executives. And so we had a pretty tiered academy in terms of getting that to happen, so you could plug that in and you could go to those specific offerings in order to be able to grow. Now, the problem is that as we got into that, 2005, 2006, 2007, what I started to feel is that, are we really growing the right people? Are we really looking at where we need to be a year from now, 5 years from now? What are the competencies, the things that were going to be necessary in order to be able to lead effectively? And so what I started to struggle with a little bit, and Bernie and others kind of helped with fleshing it out, is how do we take performance management, how do we take talent reviews, how do we take succession planning, how do we take intentional development and put it into one package? And so that's what you're going to see now, and it is called, as you see here, our succession. But I want to get specifically about our cycle. Now, I'm not going to go in a lot of detail here, but what we've done is we've established for the first time a cycle, and I think we may have taken this from Henry Ford, I'm not sure, or maybe Joe, it was you. But we went through in terms of every January, February, everybody's reviewed, just like everybody normally is in a healthcare institution. But at that point in time, we also kick off what we call our exec advance, or our P advance for physicians, or our advanced program for clinical leadership and looking at those areas where we really need to be able to have some expertise there as well. So going around the wheel, the program begins, the advanced programs begin in March. In April, May, June, Now we start to have the divisions, so the top person in each division is starting to look at, for the first time, who are their people that would replace them if something happened to them. So now we're starting to bring in the succession planning piece. And you keep going through that, through July, where the division leads present to their bosses who their succession plans would be. And then you go into August, where the corporate vice presidents and the senior vice presidents take all the roll-up of the folks underneath them, and you start to develop, for the first time, what we call a depth chart. And it's a depth chart that really looks at, from an organizational standpoint, not just for the CEO or for the senior execs, but every level, from that level all the way down through the managers. And so at the end of 2014, we're going to have, for the first time, a depth chart. Now, why is that important? Well, now we're going to know who is what we need to develop. We're going to be able to better track their development experiences by putting them through some of these programs that Bernie's going to talk about in just a second. So it's really an attempt to be able to start to pull all the succession, the development, and all those kinds of things together into one cycle. And then again, on the left-hand side, you see there, these are all things that we continue to do with all leaders. So just because you're not in succession doesn't mean that we're not going to grow you, okay? These are other things that we'll go through. Everybody's going to get 360 assessments. Everybody's going to get individual development plans. That's all part of the normal supervisory relationship. Okay, so what is a depth chart? Well, if you look at a senior vice president like Mike, then there's a couple of folks that, who would he designate as being folks that would replace him, okay? Or folks that have the biggest opportunity to be able to replace him. Then what we do is we take these folks and we develop individual development plans. Mike is the one that would be the shepherd of that, and he'd be working with those folks, just similar to what any other progress would have. Then we start to look at the next level down. So if there's a vice president that could take his place, then we'll have directors that would take those places. And those things are starting to happen now. In fact, I think, Bernie, it's already started for 2014. We've gotten down to the director level, and then finally to the manager level. So at the end of the day, at the end of 2014, we want to be able to see one depth chart all the way through. So Bernie, why don't you help us out a little bit now with what we do with those folks to intentionally develop them.
Thanks, Dave, and I appreciate being here this afternoon. I am going to talk really quickly. That speed dating is important, but I'm also a critical care nurse, and we know how to very quickly assess and get things done. So I'm going to run through this quickly, and we'll be happy to answer questions afterwards. So as Dave and Mike mentioned, the programs that we're going to talk about, succession plan programs, are tied into our strategic plans and also tied into our Sentara Leadership Institute, which guides the development of all our leaders, not just in the succession plan, but through all the levels of leadership. I'm going to show you a couple of tools real quickly. Dave had mentioned our succession plan program. And this is a tool that is actually done in the first part of the year. So when they're actually meeting with their supervisors and completing their performance reviews, we're also having them complete their succession tool, which will allow them to pick one or two, and sometimes none, successors for their role. This helps, this tool, because it helps them think about intentionally those folks who are the up-and-comers, and not just looking at within their department, but also outside the division. It's really key that as an organization we continue to grow, it's important to think about our bench strength across and not just within our silos. And so what will happen is they will complete these types of tools, outlining their up-and-comer with some metrics so that they can explain, yes, this is why this person would be a great successor, as well as some information regarding them in their current role. What were some previous positions? And many of you have probably already done some of this as well, and looking at potential for leaving the organization, the impact if they've left. And so these are key components of our successor development plans. We also have a piece there at the end, core development activity, and that feeds into those individual development plans that Dave mentioned as well. So the advanced programs, we have 3 different tracks. We have an executive development track, which feeds into our up-and-comers for any type of executive role, from our healthcare to our nurse to our physician leaders. We have our advanced program, which are up-and-coming managers and up-and-coming directors, and that's in all divisions, not just in the hospital division. And then our P-Advance, which is specifically for physician leaders that we will utilize, again, across all of our divisions. It is a succession plan program that is intentionally designed to develop folks before they hit those next levels, and to give them some exposure and some experiences to build their skill sets and their knowledge about those next levels. So our executive advanced program is an 8-month program, and you're going to see similar components between all 3 programs, but they have a little bit of different twists. So our executive advanced program actually has leadership training for our cohort sessions where we bring these leaders in. We'll have leader trainers that are actually utilized from the system, bringing information that they will need to know as they move into those advanced roles on various topics, from finance to strategy, different components that they will utilize in that next role, the executive role. We also send them to the Center for Creative Leadership for a week, where they will learn about different components of the healthcare forum. In industry, they also will get their 360 and coaching there through CCL, and that has been immensely valuable to them as they're learning about what they need to know for the next level and learning about themselves, again, as Dave mentioned earlier. There's coaching and mentoring that's included, and I won't have time today, but I will go through just briefly. The executives and the physicians are paired with one mentor that will help guide them, brainstorm what they're going to need to know, who they're going to need to connect with, and some development things that will get them ready again for those executive roles. And then, of course, project work. We've heard a lot of that today in the various sessions, key to support their development again towards that next level. Metrics is something that we've also monitored to make sure that we understand the retention, the promotion from these programs, and then, as you can see, the other metric as far as HR, members of the team, customer service, at the 1-year and 3-year mark after they've been promoted. This is key so we can see how well they're doing, but more importantly, is our program making sense? Do we need to change some things so that we have folks more successful as they graduate from the program? The next is the advanced program, again, up-and-coming managers and directors. It is a 6-month program, keeping in mind we've got some exempt and non-exempt people in this program. And so we want to be real careful about that. We actually administer the 360 component of this actually on site and to do the coaching as well. We've got certified facilitators for that. The mentoring is a little bit different for this group of folks. What we've done is actually, instead of giving them one mentor, because these are up-and-comers that are still trying to figure out what track they're heading towards, is we give them 5 different mentors. Those 5 mentors are actually in line with our different leadership competencies. So they will be exposed in a 5-month period of time to 5 different leaders in different departments, different divisions, outside of their specialty, so that they can learn about leadership competencies, but they also learn about different aspects of the organization, which has been a huge value, again, in building a comprehensive understanding of an organization at the lower levels. Project work, and individual development plan is also key. The individual development plan for these groups, again, is a little bit different. What we've done for these folks is we've taken a look at where they're going to go, what does that job description look like, and then we've taken that and put it into a template. So their individual development plan is actually utilizing the job description of where they wish to go. They will sit with their boss, they will outline different activities and time frames during the program so that they can begin to get some of those activities, some development during the program, and then it's an ongoing from there. And I'm not going to get through all of this. The P Advance kicks off actually the first quarter of next year. Similar elements, 6-month program, and it's similar as far as in line with the executive program. The one mentor will sit with each of them and build their individual plan as well. These are a few of the tools I'm just going to jump through. And I'm going to get to something that's real important here. This is feedback from the participants. We thought you'd like to hear from them what they feel about the program.
The Advanced program is offering us something which I have not seen in certainly private practice. I have not seen in any of my residency training, did not see anything in my college and my medical school training. It basically offered you a glimmer into the way the rest of the organization can survive, thrive, and function. And as a physician, I certainly have a specialty knowledge in medicine, but a complete lack of some very important kind of skill sets that I needed to move forward, to even understand how an organization like Sentara or any other organization works. And without these basic building blocks, I think it's somewhat of a language that I'm learning, and then learning how to communicate effectively, not only both ways to where I'm listening, but also to where I can now express my ideas of the viability of how certain aspects within our company run, to where I can communicate effectively to the leaders around me and the leaders above me. Probably the most important thing I got out of it was relationships, and relationships with people who, again, are going to need to be supported by me and to support me as we move up through the organization.
One of the benefits that I found from being in the executive leadership program was the ability to network with other people that were being groomed for the executive roles within Sentara. I was able to work with vice presidents and executives across the continuum and got to understand how their roles were able to impact our Sentara strategic plan. Being in this program allowed me to have the confidence to go to my team and help lead them in how we impact the bottom line, looking at quality, safety, financial stewardship, and the strategic plan and how it all impacts the future of Sentara.
I used the Leadership Advancement Program to my advantage. The Leadership Advancement Program gave me the opportunity to deep dive into the role of clinical manager, and I used that program as a stepping stone and an extended orientation to the role of clinical manager. The benefits of the Leadership Advancement Program was developing those relationships and mentorships with other clinical managers within the various hospital settings. The Leadership Advancement Program really gave me a great opportunity to seek out and learn the challenges in the day-to-day operations of a clinical manager.
Outcomes, just briefly, we're just starting to get some of the metrics, and I know I'm about time here, but as you can see, both on the executive advanced and on the advanced programs, we're monitoring the retention rate, promotion rate. And I will tell you, on the advanced program, those folks, as far as in the spring and in the fall, just ended in August. And so we're already seeing some great numbers on those folks. Other metrics, again, post-promotion, so we're just in the infinite stages of pulling that data together. And the innovation piece has been huge. So in cross-pollinating leaders across all divisions and through the company, the best practices, the sharing of resources that they've come up with and ideas has added huge benefit both on a financial aspect as well as on a resource aspect. And so wanted to share that with you. And then considerations, is your culture ready? As far as your senior leadership on board, are we ready to look not just in the silos, but outside of the silos as far as your leaders as being resources. So are you willing to share your leaders and not just keep them within your areas? Resources and program availability.